Okay.
Hey everybody.
Hi.
Today we're going to be talking about reducing your risk of colon cancer. And so we've got several different pieces of that. We'll get into it, but I'm Dr. Philip Oubre.
I'm Aubree Steen. Nice to meet you.
So we're going to be talking about reducing colon cancer risk. So colon cancer is one of the top 5 cancers that kill people, unfortunately. It's not usually one of the most aggressive ones that you've probably heard of is quick to kill. But there are things that you can naturally do to reduce your risk of colon cancer. A general statement to start all things off with is you can reduce your risk of all-cause mortality, which means cancer and strokes and heart attacks and everything, by 70%. That's more than any drug, any food, anything in general. 70% reduction just by eating a clean diet, moving, and not smoking. So first of all, if you're doing any of those 3 things wrong, fix that first before you start worrying about what tests you need to do or what your family history is. 70% reduction across the board by eating clean food, not smoking, and moving. Pretty simple, okay? But we're going to get a little more granular on that. So one of the first ways you can do to reduce your colon cancer risk, of course, is your colon is the thing that's helping digest and absorb your food, right? So most likely it's got a link to the foods we eat. We talk a lot about the gut, but today we're going to be focusing on what?
Yeah, so foods that can promote that, carcinogens, right? So obviously go to our other Get videos, because if you have different overgrowth or toxins or anything like that, you can increase things like calprotectin, things that lead to inflammatory bowel disease, eventually cancer, yada, yada, yada.
Yeah, anything of chronic inflammation always creates more cancer.
Correct.
So you can avoid carcinogenic foods, but if your bowel is totally inflamed, you have a higher risk of cancer.
Right. So when we talk about carcinogenic foods, we're talking about foods that basically become something toxic. You're thinking right now the number 1 food items that you can avoid are things that have been burnt. So you're thinking of barbecued, heavily fried foods, things that are actually denaturing the protein in the food molecule itself. A lot of times, those crispy bits on the barbecue are our favorite. The brisket burnt ends in Texas are so good. Make my mouth water. Those are the unhealthiest ones for you. And when they turn black, you think about like a piece of toast that turns black, you're completely just ruining and denaturing that molecule, and it actually turns into a carcinogenic, cancer-causing toxin. And you think of even fried potatoes, anything that's actually a carbohydrate that's fried and exposed to high heat produces something called acrylamide, and that's also a known toxin that can wreck your system. So ideally what you'd want to do is have whole foods, right? If you are roasting foods, you want to do it with a nice kind of like avocado or coconut oil on a lower heat. You don't really want to flash cook anything with high heat, including a microwave. You want to have that low roll, like a nice roasting, a slow saute, things like that. That's one of the biggest things that you can do, honestly.
And we love crispy Brussels sprouts with the crispy flakes and all that, or leaves, but not the greatest to have crispy. Not to say Brussels, they're still healthy, right? But if you can, as Aubree said, lower heat, roast, less brown and burnt stuff is better.
And it causes a lot of oxidative damage in the body, but they have proven that if you were to have a charred piece of meat and if you have almost identical matching portion size of green veggies, that it actually reduces the carcinogenic factor of that meat itself.
So if you eat broccoli and burnt ends,
it's better. It's not as bad because we can't avoid it 100%. So if you are going to do it, lessen it as much as possible and at least have a good amount of healthy green veggies beside it.
All right. If only the barbecue joints knew that. In Texas, you can't get broccoli with your barbecue. The best you can do is coleslaw, which that's got a little sugar and question in it anyway. Sometimes they have green beans, so got to make your own broccoli and bring it to the barbecue joint. You'll be the cool kid on the block.
That's so good.
So colon cancer, there's many things you can do to reduce. Of course, no smoking. That's just a no-brainer. But the other thing you can do is, of course, test. But I always like to take the emphasis off of testing, because testing just helps you detect it early. But it's much better to prevent it so that you never have to worry about detecting it early, because it just never happened, right? I've become a big fan over time of ColoGuard. It's still new, so it's not the most favored across physicians. But the reason why I like ColoGuard is that the single biggest threat to people not doing testing is being scared of the test. So people do not like colonoscopies. It's disgusting to do the prep. If you've never done it, just wait. You might do it one day. The anesthesia, and there's risk of actual harm in the colonoscopy.
Right.
These days, we do so many of them in America. The GI docs do these round the clock that we kind of act like it's not very risky, but there is a significant risk of bowel perforation. I think the number is 1 in 1,000 colonoscopies end up with a bowel perforation. These are usually small, and you end up with a small hospitalization or something, and you get out. But still, that's
Small
still
hospitalization.
a hospitalization. Like,
Yeah.
rarely do people die, but anytime you go to the hospital, there's always that risk, right? So colonoscopy is a little bit more invasive. What I like about ColoGuard is it's usually insurance covered. You got to poop in a cup and send it to them. Yes, it's gross. You poop in a cup and send it to them. And what they do is they test for DNA markers of cancer. And so if you have any DNA markers for cancer, then they tell you you're positive. Now you have to go do a colonoscopy anyway. So the downside, one of the downsides to ColoGuard, other than scooping your own poop, is that you have to do it every 3 years in order to be equal to colonoscopies. And so colonoscopies, if you get a complete normal one, they'll let you go 10 years. So I read an article recently from my family practice board, and they were suggesting that ColoGuard leads to more false positives and can lead to more testing. That doesn't really make a lot of sense to me, because if you're not doing colonoscopies and you do ColoGuard, if you get a positive one, yes, you'll have to go do colonoscopy. But over your lifetime, you're less likely to get false positives than the amount of colonoscopies you would get if you just went straight to colonoscopy. The other thing that's in flux right now is typically most doctors are recommending colonoscopy starting at 50, or colorectal cancer screening, whether that's ColoGuard, whether that's colonoscopy. Those are my two favorite. There's also blood testing, blood testing in your stool. And my last, don't worry, I'll keep talking. So if you have blood in your stool, that's another way to test. But that's the old version. We don't really do that anymore. So ColoGuard or colonoscopy are the main two. So the usual starting age is by 50. You should have done one or the other. ColoGuard every 3 years, colonoscopy every 10. But now they're trying to push the age down to 45. And that's kind of scary, because what that's telling me is we're finding cancer earlier and earlier and earlier in people. And so that means that if we're reducing the age, that's a higher risk. And it makes sense if you look at our population. We continue to eat terrible foods. The standard American diet is terrible. It's inflammatory. It's lots of sugar. So, of course, we're seeing more colon cancer. So have a discussion with your doctor whether you should be doing colon screening at 45 versus 50. But I wanted to at least put the message out there that there is an alternative to colonoscopies. ColoGuard, simple, send it to the labs, done through insurance. And for what I understand, it's a tedious process for your doctor to fill out forms and stuff, trust me. But it's simple to do pretty much. But number one is 70% reduction across the board of all ways to die, minus getting hit by a bus or something, by eating clean foods, moving. And notice I say moving. I'm not saying oh my gosh, you got to go do a marathon or something. I'm just saying move your body, whether it's walking around the block, walking your dog, whatever it may be. Just move your body, yoga, something. And then 3 is not smoking. That's just a deal breaker. So that's all we'll say about colon cancer screening. And we'll see you next time.